All right. So, which of the following is a known complication of chronic lithium toxicity? So, this is a rather straightforward question. Let's just dissect it, make sure we know exactly what it is asking. So, we have chronic lithium toxicity, and we need to identify which one of these is a known complication of it. And our answer choices are A, diabetes mellitus, B, hypoparathyroidism, C, nephrogenic diabetes insipidus, and D, syndrome of inappropriate antidiuretic hormone. So looking at these answer choices, I could group them in that C and D are related, right? They both have to do with antidiuretic hormone. And what's interesting about this is you can't have both of these necessarily at the same time, right? Because one is too much ADH and one is too little ADH. So keep that in mind when we're thinking about these answer choices. And this is one approach you could take on an exam if you don't know specifically the complications of chronic lithium toxicity. If you look at the answer choices, you could see that you have two competing answer choices here, C and D. So my suspicion, without knowing anything about chronic lithium toxicity, is that either C or D are likely the correct answers. And then what's interesting is we have answer choice A, diabetes mellitus, and we see diabetes in the answer choice, and we see diabetes in answer choice C. So again, A is a distractor in there, most likely. And then B, hypoparathyroidism. We just need to think about that a little more deeply. So let's look at each answer choice and see what we come up with. So diabetes mellitus, that is, as far as I am aware of, not a complication of chronic lithium. So we'll cross that out. Answer choice B, hypoparathyroidism. So as far as I'm aware, that is also not a complication. You can have hyperparathyroidism, right? Because I know that you could see hypercalcemia in chronic lithium toxicity, but hypoparathyroidism would not lead to that. So I'm going to cross that out. So now we're left with nephrogenic diabetes insipidus and syndrome of inappropriate ADH release. So here's what I do know about chronic lithium toxicity is that patients who get this typically first exhibit neurologic symptoms relative to acute lithium toxicity, where it starts off with early GI symptoms and the neurologic symptoms are delayed. And so when I think about patients with chronic lithium toxicity, at least clinically in my mind, they always seem like they're like dry and dehydrated. And so if we look at those answer choices, which one of those would present a patient like that? Well, nephrogenic diabetes is the result of, in this case, it's the kidney becomes resistant to ADH, and therefore you will have a patient who's urinating frequently, right? Whose plasma level of sodium rises because they're urinating so much and losing free water. And what happens is that becomes a vicious cycle, right? So the more free water you lose, the greater the concentration of lithium, and therefore you become more toxic. All right. So nephrogenic diabetes is certainly a known complication for chronic lithium toxicity. And therefore, I'm going to cross out syndrome of inappropriate antidiuretic hormone and go with nephrogenic diabetes insipidus. And let's make sure we're correct. And sure enough, that is the case. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh, signing off.